All right, welcome everybody. We are going to be starting the webinar shortly. We're just going to give people another minute here to join and then we'll get started. We are going to be talking about the glass peel microneedling. For me personally, this is one of my favorite treatments. For a long time, I was doing it monthly, every single month. My patients have now become addicted to it. It has so many amazing benefits that we will get into, and Laura will talk about how you're going to get that glass skin. And then at the end, we are going to be doing a Q&A. So if you have questions, type them in as you have them, and then we will answer them all at the end. All right, so it's 6:03, so let's get into it. So let's talk all things glass peel microneedling. So my name is Marisa Garcia. I'm a medical esthetician at Sanctuary at the Fort Lauderdale location. I've been in aesthetics for almost 9 years now, and microneedling is one of my favorite treatments. We will be talking about the overview of what microneedling is, what makes it a glass peel, who is a good candidate, what to expect, and then we'll watch some demonstrations of the treatment being done, as well as some before and afters. And then reminder again, ask us all your questions. We'll be doing a Q&A at the end. So microneedling is essentially a collagen stimulation. In the treatment, we use small sterile needles that are creating a puncture in the skin that create a micro injury. Think about when you get a cut on your hand. Your body goes into a regenerative state to repair and heal your skin. We are essentially doing that with a controlled injury so we can stimulate a very specific response that is going to do a lot of different things. And again, when we are puncturing that skin, we are creating microscopic channels that are aiding in product penetration. So in the treatment, we're using some serums and there is no wait time. That's immediate absorption, and it also creates a glide for the needles. So we're never scratching or tearing the skin. It's very comfortable on the skin, and you will see here, we have a video of the treatment being done where the little pen and tool is vibrating and those micro punctures are being created, and then we're topically applying that serum on the skin. So we went over microneedling and it's creating a collagen synthesis. What is that? You want to think about your skin like a mattress. Over time, it's become worn out, flattened, and it's just a little worn down. So we need to fluff up the mattress and bring the springs back to your skin. So we are, again, creating that micro injury, and one treatment has continued improvement for up to 90 days when your skin is going into that regenerative repair state where we go through an inflammation stage and then we are building collagen fibers, and then those fibers are creating that structure back in your skin and giving you good support, plumping up your mattress. And then, like we said, that continued benefit is for up to 90 days. In our office, we do treatment recommendations, typically in a series of 3, treating once a month for 3 months, approximately every 4 to 6 weeks. And then once we get to our happy point, we shift over into maintenance, where you can either treat with microneedling once a quarter, or again, repeat the series 1 year later in entirety. So let's talk about the glass peel. So we've talked about the microneedling. This is what really makes this protocol unique. Think about getting the benefit of a microneedling treatment and a chemical peel in one. It gives you that glass skin, and we are using a very specific ZO skin health protocol developed by Dr. Zaino Baji, and this specific protocol was developed by his daughter, Miss Serena Baji. And what makes this treatment so special is we are using complexion clarifying serum, which is a salicylic based serum that opens up the treatment to so many different patients that we typically don't see getting microneedling done, like acne-based patients, oily, rosacea-based patients. They are all going to be great candidates because of this specific serum. So the serum that we use is going to be custom based off your skin type and your concerns, whether it be firming or brightening or wanting to refine facial contouring with peptide serum. But again, we are always going to use that complexion clarifying serum to address retexturizing that internal structure of your skin. The water-soluble salicylic is going to slowly disperse that ingredient, reducing visible redness, clearing out internal congestion like those under the ground pimples or just like blackheads and comedones. And it's going to also reduce that oil production as well. And then the peel portion of the treatment really comes down to radical night retinol. We refer to this as the velvet hammer. The retinol is typically not used in a microneedling treatment. It's actually been historically told to be avoided. But with this retinol, it really does help amplify the results of the treatment by speeding up the recovery, but it does that via skin shedding. We're applying that retinol again to help push out dead skin cells, discolored skin, pigmented skin. Also, post-inflammatory erythema. When you get your breakout, that red mark lingers for quite often. That red mark lives on that surface of your skin in the upper levels. The radical night repair helps to push that skin out, revealing bright, even skin. And then we also have skin enhancements. We can either boost or support your results. So boosting goes back to the radical night retinol, where for my advanced patients, I would consider this an advanced protocol where we continue to apply that retinol on after the treatment twice a day for up to 3 days. It does give you quite a bit of peeling. So again, those are for my patients who are comfortable with the treatment, but it's going to give you that enhanced boosted result. And then we always suggest supporting your results with topical serums that you're using every day at home. The highly concentrated serums that we are using in the office are available in retail versions, because anything that you're doing in the office is wonderful, but something that you are doing every single day, twice a day, is going to give you more meaningful results. If we look up the before and after on the screen, that is just a topical application of peptide refining concentrate. Imagine if we were to combine that with microneedling. We might not have any wrinkles on her face. It would be amazing. Who can get benefit? If you have skin, you can get benefit from this treatment, but specifically if you're looking to address the texture of your skin, minimizing those pores, clearing out any redness or pigmentation, this treatment is going to give you benefit. And again, I also want to call out patients who also experience acne or oily skin or even clogged pores. They can get benefit because again, we're helping amplify the texture. What to know before the treatment. You're going to want to come in for a consult with myself or any of the other providers in the office to make sure that your goals are in alignment with the treatment. So where we would go over your history of your skin, setting up clear expectations, and ultimately gauge if this is the right treatment for you. And then immediately before the treatment, you'll want to avoid coming in with any excessive sun. Please do not come in with a burn. And then avoiding any retinols or active ingredients for up to 3 to 5 days before the treatment. And then what to expect when you come in. So I always tell patients, you could potentially be red on day 1 or day 2. You could walk out of the office with absolutely no redness. And then it's totally within the realm that you could wake up with that redness tomorrow or the next day on day 2. That's the retinol working. Or you could be red day 1 and nothing on day 2. And if you're special, you could be red on both days. Day 3 to 5 is when the peel component of the treatment starts coming in. We could have mild to more intense peeling. That is really dependent on you and the provider determining how much you would like to peel. To give you reference, we could do anywhere from 3 to 12 pumps of radical night retinol. So I could give you a little peeling and I could give you a lot of peeling. But all in all, by day 7, we are 90% healed and the texture is feeling buttery and so soft, and you're asking me when you could do it again. So how are we going to care for the skin? Post-care is always discussed in the treatment room. I'm going to go over thoroughly what I do and don't want you doing. And we really, at the end of the treatment, you have nothing to do. I want to have you marinate in everything that I finish your skin on the end. Your only homework the day of the treatment is to ensure that you have a clean pillowcase. The following days after, you're just going to want to be avoiding sun, avoiding heavy sweating for the first 3 to 5 days, and then supporting the skin with simple skincare, washing, moisturizing, sunscreen, sunscreen, sunscreen. Unless we have you doing any other specific products, that would be discussed with the provider. If we're boosting our treatment results, we might be using other things. So we've discussed the post-care. Let's talk about and watch a demonstration of the treatment being done. And again, I'm going to kind of talk us through it. And again, if you have those Q&As, make sure you ask them in the chat. So this is the treatment being done, maybe. There we go. This is the treatment being done. We are working in side to side motions, going up and down, going in circle directions. We're really just ensuring that we have really even coverage. I want even endpoints, that her skin is giving me a little redness. And you could see we have that glide on the skin. It's never scratching or tearing at the skin. You could also see she's extremely comfortable. The treatment is easy. She's talking at ease. And we're just applying that product and making sure we have that full saturated coverage to give you the ultimate stimulation. And then we have our radical night repair application. We typically apply this in all quadrants of the face and then apply evenly. At this point in time, this is when patients usually start to feel a little bit of a heat sensation on the skin. That is pretty normal, and that will dissipate as the night goes on. And then she's going to continue to get her results over the next few days after. So let's discuss some healing diaries. So we can see immediately after she has that typical redness. And then this looks like it's probably about day 2. She's looking a little dry. It is pretty common that on day 2 or 3 that your pigmentation can appear a little bit darker. And that's really the retinol working. That retinol is pulling that pigment and speeding up those cell turnover to expel all that pigmentation to reveal brighter, smoother skin. And then about on day 7, she is looking radiant, soft, her makeup is laying so good, and she just has a beautiful glow. Beginning results of 1 session. This is just the beginning, and this is a really amazing before and after, and it's only the beginning. We can see here that she has very even skin tone on her cheeks. The texture of her skin looks softer. She's not wearing any makeup in the second photo or either photo. And she has a ridiculous glow in the after. And then she also does have a little bit more of a sharper jawline contour as well. We have some more healing diaries. We have immediately after leaving the office, we are a little pink. She's probably feeling a little spicy. And then this looks like it's day 3 where she's starting to peel. Peeling typically always happens around the mouth because this is such a mobile area of the face. And then that peeling will continue to go up and out. And then we have day 7, where her makeup is stunning. Her texture of her skin is amazing. It looks like her makeup's airbrushed. It looks beautiful. And then another beginning result of 1 session, we have a really amazing improved volume in that nasal labial fold and that orbital socket. And then this patient also supported his treatment results with peptide facial refining concentrate to again help amplify the volume of the skin and supporting his in-office treatment. And then we have our special for the webinar. So this is exclusive to patients joining us tonight. We have a purchase of 3 sessions of level 2 microneedling. You can receive 20%. And then if you choose to boost and support your results, you will also receive 15% off retail products as well. And this special will be available until next Tuesday. So you can come in, call, we can have a consultation, and then we can get that process started for you and get your skin glowing on your journey. So thank you so much, everyone, for joining the webinar tonight. Right now, we're gonna dive into some of the questions of what we have, of what people are asking.
So Marisa, the first question is, if I don't get facials regularly, do you feel this is a good option for me?
So it can definitely still be a good option, but having that consultation with us is going to be really important, because if your skin is in a very stressed or impaired state, like your barrier function isn't at an optimal state to receive the microneedling, we would just segue into another introductory treatment or get you set up on supporting home care products to make sure that we can have predictable outcomes from the treatment and make sure you have good, easy healing at home, and then ultimately give you your great results.
And someone else asked, what would you say the pain level is after the treatment?
After the treatment, the pain level is pretty minimal. On a scale of 1 to 10, maybe a 2 or 3, all you're really feeling is that heat sensation of that retinol having immediate delivery into your skin. But I would say it's very mild. The treatment itself is extremely comfortable. I always tell patients the only area that maybe feels a little bit prickly is when we do your forehead, just because it's skin on bone, and that's, the most delicate part of the space, and it has the least amount of cushion. And we get it over with right in the beginning, and then cheeks down, the treatment's very easy. After the treatment, barely anything.
And someone else wants to know, how does this compare to traditional PRP microneedling?
That's a great question. Everyone sees PRP online and the internet, and it's very buzzy and trendy. So where PRP can do better is it's platelet-rich plasma, that where we take your blood and we spin it and we put it in the centrifuge and we get those really great cells. But that PRP is very dependent on the patient that it's provided from. What are your hormone levels? What is your diet like? Are you dehydrated? An 80-year-old person or individual isn't going to be having the same PRP quality of an 18-year-old. So it's not as predictable, and also it's not as specific. We are focusing on very specific concerns when we mix up this skin cocktail for you. Like I said, whether it's firming your skin or brightening your skin, we're able to target a more specific skin condition. So I think this protocol just has more range, and it gives you a better overall result because we're targeting whatever your specific concern is, not just general skin healing with PRP.
And someone else would like to know, when are peptides applied?
So the peptide solution can either be applied in the custom cocktail. We can microneedle with it, or we can also be applying it after as aftercare to boost your results. Um, Typically it's done after the treatment, and then you can start that the next day. And then in the treatment room, I would apply it on the skin, put the retinol on, and then I would send you home with that retail product to support as post care and then support your results.
And someone else would like to know, is this safe for acne skin?
This is definitely safe. It's going to depend on the grade of acne as well. If it's cystic acne, it's probably not going to be the treatment for you at this time. Once we have that acne a little bit more under control, you're going to be a great candidate because again, it's going to get rid of those red marks that you're seeing on the skin, that post-inflammatory erythema. If it's just blackheads, whiteheads, that kind of thing, you would be a great candidate for this treatment. That water-soluble salicylic is really the star of the show and helps facilitate the dissolving of oil of that comedone, which is the blackhead, and helps ease and just support that. So yes, most acne patients would be a candidate unless it's quite severe, but then once we have that under control, perfect candidate.
And someone else would like to know, let's see, we just had one come in. Are all the at-home products to apply afterwards included in the price or purchased separate?
So the retail products would be included separately, but with the special, you will receive 15% off those products. And typically, to give you an idea, most of ZO's retail products are designed to last 90 days. So they will support your skin for the entire journey of the microneedling series. So the microneedling is separate and then the retail is also separate, but you do receive a discount on both.
And another question is, how do you know if I need 3 treatments?
So we typically always recommend 3 treatments in the office. We offer discounts on packages of 3 or more. But also when we go back to that collagen stimulation, one single treatment has benefit for up to 90 days. So if we continue to capitalize on that stimulation once a month for 3 months, you are just going to have so much more meaningful results. But say you are a person that is happy with your skin, you're already at your maintenance point. You could, of course, still get benefit from a one-off treatment, but typically for patients who are looking for more corrective procedures and looking to improve their skin quality, they will really see the impact and the benefit from a series of 3. And then, of course, if we're having, a patient come in that has a little bit more severe lines or has even, a little bit more intense acne scarring, they might need more treatments. That's why doing a consultation is also so important. So we can clearly assess your skin and set up expectations according to your goals.
I think this is a good question too, because at Sanctuary, we have so many lasers and a lot of our patients are in a laser journey. Someone asked, if I'm just doing lasers right now, when would I get this facial or this treatment?
That is a good question. There's going to be a lot of answers or a lot of explanations. It really depends on what lasers are you doing now and what our ultimate goal for the skin is. But we do so many lasers in the office, and there's definitely room for both treatments to play well with each other. In a lot of cases, We can moxie your skin 1 month, which is a laser that we offer in the office. And then about 4 weeks later, we could continue with the microneedling. And then again, another 4 weeks later, you can continue with your moxie. It's just going to depend on your overall goal, but both treatments play well with each other. They just need to be spaced out in appropriate times.
I don't see any other questions. Marissa, I don't know if you want to go over one question that you always maybe get when people are receiving this treatment, or what you hear feedback from patients, anything
I
like
think the
that.
biggest thing that shocks people is, when you see microneedling on the internet, you see like the vampire facial, and it's that video of Kim Kardashian where she's all bloody and it looks, ridiculous. Patients have a lot of fear when they come in to get this treatment, and they're nervous and they're scared and they think it's going to hurt. And then once I start the treatment, they're like, oh, this is it. And I'm like, yes, it's actually just such a comfortable treatment. People are shocked that it's as easy as it is, and they're just amazed with how smooth and how soft their skin feels once you are fully healed. Um, it's my favorite treatment. I've done it on myself once a month for about 5 months. And then I did our advanced protocol where I continued to apply radical night retinol, 5 pumps twice a day for 3 days. Sounds like a lot, and it was. There were definitely times where I really had to gear myself up to put that retinol on, and I peeled for 12 days. But I haven't done it since, and I think my skin looks pretty nice. So yeah, everyone's fallen in love with this treatment. It truly is unique and has something to offer everyone. And the reason I like it so much is because I have rosacea, so it keeps my redness under control and my oil as well. So just want to thank everyone for joining again tonight. That special that we have will be available until next Tuesday, so you can call the office and set up a complimentary consultation to find out if this is in line with your goals. And we appreciate you joining so much, and we can't wait to share this amazing treatment with you. So thank you, everyone.